with the e-health, to drive forward through e-health our priorities for change as identified in that IHSP document. So it's a critical enabler for innovation and integration, because ultimately our vision for the Southeast and for the province is and still remains a high-quality, accessible health system within the resources we have available that will be here into the future for our grandchildren. E-health also enables communication, and that is another critical underpinning necessary to drive forward with our priorities for change. That communication to link providers so that they have the information necessary to provide the right care path and care plan and interventions for our clients or patients wherever they are along the continuum, and for the public itself as well, to focus on the results, their personal health results, but also the results of how we're spending their tax budget. Remembering if you try to start and improve it, no idea. So reaching for excellence is our IHSP2 document, shortly to be received in its final form, but the draft is on our website. And the focus is on achieving better health for those who live and work in the Southeast LHIN. Our goal is the high-performing health system, and there are a number of pillars that are under that roof that we're trying to build. Quality care, focus on patients and people, integrated delivery, effective services and programs, community engagement, and financial health sustainability. All of these aspects, all of these pillars can be approved. We can work towards achieving strength in each of them through the use of an integrated and strong e-health system. So what are our priorities for change? You'll see on the next slide that we actually have a priority for change around e-health system development. But as you read through each of these, you can see that there are components of each that can be improved through the use of effective e-health tools. Developing the system of primary health care. We have a Healthcare Connect model right now, but actually have linking community health. Very good of private health team care that we are independent, our key health practitioner center, and nurse practitioners. Linking all of them together will improve that system of primary health care. And just a bit of a plug for a primary health care forum that will be setting up in January, February of this year, so keep an eye out for that on our website. Enhancing the culture of patient-centered care, improving mental health and addiction services. That's a provincial and a local priority, and some of you may have had an opportunity to participate in the recent provincial engagement sessions around access to mental health services and an opportunity to have comment and feed into that dialogue. And they'll be continuing to have opportunities over the next 3 years as we move forward. Developing regional program management, using the resources that we have available within the Southeast, our on over $920 million for just under 500,000 people, using that most effectively, making sure that we're not duplicating, that everybody is providing the service necessary within those dollars without duplication or reasonable access. And we think that a focused regional program through management will assist us in doing that. I think we're doing this to emergency. We have a lot more. We are to improve. Many of you are involved in one form or another with some of our initiatives as we work to achieve reduced wait times and improved access, whether you're in CCAC or hospital or the CSS community. Reducing the incidence and prevalence of alternate level of care. Again, I know many of you are participating in this particular priority for change as well. Implementing the Ontario Diabetes Strategy, and one of the projects that we'll be discussing later, particularly with regard to moving that particular strategy forward on the e-health front or using e-health tools. As you can see, an independent priority for change, actually furthering access through the use of e-health. Expanding cultural and linguistic healthcare services. Kingston was identified under the French Language Services Act, so we have some work to do to move forward in our access in particular to French language services. And advancing system improvement through boards working together. All of us in this room are leaders. Our patients are also members and have put into how the system improves our makers. Into having our help with that together, our board approved the decision to actually implement change work to make it successful.